Okay, we're doing Gaenslen sign. This tests for hip pathologies, SI pathologies, and possibly a nerve root problem at L4. You bring the leg back and hold it here, extend the hip back and hold. And if there's any pain, any problems in the hip, SI, any pathologies in the hip, SI, or L4, it may show up with this test. Okay. We're going to do a supine sit up test, and what this test is used for is to find out if there's a functional leg difference, a functional leg length difference. That means that the innominate bone may be anteriorly rotated or posteriorly rotated, or you could also say nutated or counter-nutated. Nutated is posterior, counter-nutated is anterior. So if we believe that the innominate bone is nutated or counter-nutated, we can test it by doing the supine sit up test. And usually a person that has a nutation, let's say it's her right side. If she's got a nutation or posterior rotation of the innominate bone, this leg would be functionally shorter. So how we test this is, first I'm going to have you bend your knees for me. We're going to do a quick bridge just to neutralize the pelvis. Come up and down. Great. I bring the legs out and I look at the heels, the calcaneus, and see if they're equal. Now, let's say this leg is a little shorter, so I think there's a nutation in this side. So in order to test to see if there is, what should happen when she sits up, this leg will become will be the same length as this leg, or it will become a little longer. Okay, could you sit up for me? And it's just a little bit longer, so that's positive for a nutation of the innominate bone. Now, lay back down again. Let's say that she has a counter nutation of this side. That means when she's laying down, this leg is going to be a little longer, but when she sits up, it'll become shorter. So you sit up for me, and then you'd see the leg would become a little shorter. So supine sit up test is not a bad test for finding out if there's nutations or counter nutations of the innominate bone of the pelvis. Okay? Okay, we're going to do the Faber test, and it tests for pathologies of the hip, SI, and may show spasms of the iliopsoas and shortness of the abductor. So I'm going to bring your leg up in a 4 position here. I'm going to hold my left hand over the ASIS. I'm going to apply pressure in a downward direction, and she actually kind of tests positive to this. What should normally happen is the leg should come down about equal the height of the other leg, close to about maybe 2 or 3 inches off the table. Hers doesn't, so it's a little positive for either a hip problem, SI, or iliopsoas shortness or adductor shortness. Okay, good. And this is more of an observational testing or observation. If you want to find out, there's 2 ways of finding out if there's a structural leg length difference. That's using a measuring tape from the ASIS to the medium malleolus. What you can also do is do a view of the femur and the tibia. What you should see when the legs are equalized and set up in this position and they're equal is that both sides match. The height this way and this way are the same. If there was, say, the femur was longer on this side, it would jut out this way further. If the tibia was longer here, it would go up higher this way. So you can measure, or you can view. You look from this angle and look from this angle and see if these knees match and they're even. Okay? Okay, we're going to do a muscle length test of the iliopsoas called the Thomas test. We're going to show the iliopsoas first and then the rectus femoris second. So we're going to bring the leg up here and hold that and pull it up. If the iliopsoas is positive, you're going to get a shortness like this. The leg will be bent and the heel may even be up, but you'll get 2 or 3 inches underneath the knee here showing the iliopsoas is shortened. That's a Thomas test, a muscle length test. Now, we're going to show you next the rectus femoris test. Okay, we're going to do the second part of this test for the rectus femoris. I'm going to have Megan lay down and grab her knee and bring her knee up. And we're looking at the rectus femoris. Now the rectus femoris, if it was normal, it should be at like 90 degrees, but hers, let your leg relax, it's a little short, so our rectus femoris is a little short here. It should be more of a 90-degree position, but it isn't. The other thing is you can take a look at the tensor fasciae latae iliotibial band. If the leg is out like this, turned out a bit, then you may have problems with the tensor fasciae latae iliotibial band. But her rectus femoris is a little short. The leg doesn't go, the knee doesn't go to a 90-degree angle. Okay, we're going to be testing the iliotibial band, tensor fasciae latae, runs from through the lateral thigh region and the hip. So I'm going to stabilize the innominate bone right here of the pelvis. I'm going to bring the leg off, extend the leg back in extension. It's really important to stabilize here. It's very important to make sure that you get the tensor fasciae latae iliotibial band over the greater trochanter and then allow the leg to drop back. And she tests negative. If the person tests positive, the leg would stay in this position. Okay, this is another muscle length connective tissue testing. Okay, we're going to do a Nobel's test. That's testing for friction syndrome of the distal end of the tensor fasciae latae iliotibial band over the epicondyle or condyle of the femur. So I'm going to palpate the connective tissue right here at this point over the epicondyle. I'm going to extend her leg out. Should be about 30 degrees out to full extension. If pain is produced where my thumb is, then it's positive for inflammation or inflammation of the epicondyle, the tensor fasciae latae iliotibial band. Okay. Okay, we're going to test the length of the piriformis muscle. So you're going to have the person sideline. You feel the greater trochanter. You're going to stabilize here. And what you want to do is you want to apply a downward pressure, stretching the piriformis. And piriformis syndrome, some people will develop piriformis syndrome, which is the compression of the sciatic nerve as it goes through the pelvis and through the 6 lateral rotators, particularly the piriformis. So a muscle test, this is a muscle length test. So I'm going to apply a downward pressure, stretching the piriformis, and we're going to show the alternate method in a moment. Okay, we're going to demonstrate a special test for labral tears at the acetabulum. Also, we'll test for impingement syndrome. We bring the leg up, we abduct and externally rotate, and we bring the leg back, the hip back, into medial rotation and AD adduction. Do hold it there. First, we'll show symptoms of pain in the groin area into the hip. Now, we can also follow that test with the starting position with medial rotation and bringing it back out into abduction. So you can go both ways with this, testing the anterior lateral side of the acetabulum for impingement syndrome and labral tears at the hip.